Welcome. I'm Dr. Mujtaba Moharer, co-organizer of the Mobility Roundtable. I will be starting the roundtable and introducing the speakers. My co-organizer, Dr. Peter Atkinson from the Coventry University in the UK, will guide the Q&A and close the session. So Peter kindly has volunteered to help me to replace Andrew for this session. Andrew Tomlinson, Dr. Tomlinson is the usual co-host. He's enjoying his retirement life now, so it's difficult to get on his calendar. Mobility and aging. Is getting old a barrier to getting about? In this roundtable, we will discuss how aging impacts mobility and how this impact can be reduced. We will now discuss these and other questions over the next hour with two excellent speakers. Ms. Jana Lynott, Senior Strategic Policy Advisor at AARP, Public Policy Institute in the United States, and Dr. Noelle Fields, Associate Professor in the School of Social Work, the University of Texas at Arlington in the US. So we are going to jump right in with our first speaker, Dr. Noelle Fields. Please, the floor is yours. Go ahead and share your screen.
Can you all see that okay?
Yes.
Great. Well, this is such a wonderful opportunity to join you all. I'm excited to talk with folks internationally, as well as our other speaker from AARP, about mobility and aging. So I crossed out the title a little bit to think about this presentation from a social work perspective, from a strengths-based perspective, and thinking about not necessarily is getting old a barrier, but what are the barriers to getting about. So a little bit about me. Again, I'm an associate professor at the School of Social Work in the University of Texas of Arlington. I'm also a licensed clinical social worker in the state of Texas. And I have been involved in several different transportation-related projects with colleagues in civil engineering and transportation planning. And I've really just enjoyed that as part of my research focus in gerontology. So a little bit about mobility in later life, just quickly. So in 2050, 1 in 6 people in the world will be over the age of 65. So that is a big number, and we are all in that. The number of older adults in the US, and I'll be talking about studies in the US, is projected to almost double by 2060. We know that people are living longer and living longer with chronic illnesses. We know that aging is linked to an increased risk of disability, and disabilities may impact a person's ability to drive a car. Of course, in the US, we're pretty driving car-centric. What else is important to know about mobility in later life? Well, aging-related changes elevate older adults' risk of car crashes and related injuries. And we know that older adults outlive their ability to drive by about 7 years. For those that stop driving, driving cessation can have a negative impact on the older adult's well-being, be that physical, social, and cognitive. In terms of aging in place, and my research focuses on home and community-based services that keep people out of institutional care in the US. So my interest is in aging in place, and that's the idea that you can remain at home as we grow older, in spite of age or health-related changes that may make it difficult to do so. So we use services and supports that can hopefully allow us to live independently and do the aging in place. And so these services and supports may increase or decrease with our changing needs and abilities. But it also speaks to the importance of transportation as one of these services, one of these supports, and the importance of mobility and multimodal transportation planning. So I'm going to talk briefly about 3 different projects related to aging well as transportation disadvantage. Most of my work from transportation stems from this qualitative study of aging well in Arlington. Arlington is the largest metropolitan community in the US without a comprehensive public transportation system. So we did a community-based approach. We did individual interviews in 6 focus groups looking at transportation mobility in Arlington. And what we found were some consequences of transportation disadvantage. All of these participants were lower income. Many were using Meals on Wheels services. And we found that folks were saying that transportation was a barrier to healthcare, goods and services, familiar lifestyle habits, and their social networks. So part of my focus as a social work researcher is on, serving and addressing the needs of vulnerable populations and looking at social problems. So thinking about transportation disadvantage as part of my own work, knowing that with older adults, this can lead to everything from delayed diagnosis and interventions to missed clinic appointments, all of these different negative potential health outcomes, as well as diminished quality of life. So part of my research from that study led to a development with my colleagues at UTA, a custom designed mobile app called MyAmble. We were looking at trying to better ways to collect data about transportation disadvantage. It captures objective and subjective data, and we're looking at latent demand in particular among older people. So this is a screenshot of our app. It has everything from a daily trip planner, which is where they plan their daily trip. We use the app in our studies for 14 days. And in both of the study I'm going to present today, the older adults were using it on a tablet. So they have a trip planner, kind of more like a traditional diary where they review the trips at the end of the day. But there's questions in there about latent demand, trips that you desire to take, but you can't take, can't actualize. There's also a challenge logger where you can take pictures in the environment, also photos, document challenges. Travel Buddy is actually a very interesting feature. One I'm most interested in as a social work researcher. I'm interested in qualitative data, and this is text messaging with users following certain frameworks for questioning. And then Travel Story just gets their travel history. So you can see a few, we tried to sort of show the differences between MyAmble and sort of other ways to collect this data, be it paper, website, or smartphone app. And so that's just a brief snapshot. I know I'm going quickly, so I can always go back later if I need to. So looking at a couple papers we published, this first one is really about the trip planner data that we found. We were looking again at actual and missed transportation among lower income older adults. And we were really looking at that in the context of their physical health. So this was, of course, set in Tarrant County, Texas, which includes Arlington, Texas, as well as Fort Worth. Arlington, again, not having that comprehensive public transit. Fort Worth does have transit. We had 10 adults, all identified as lower income, pretty diverse sample in terms of with African-American and white participants. So they logged their trips and destinations for 14 days. So we had 10 participants. This is kind of our pilot study. They logged a total of 95 daily trips. More than half were planned, and most were reported to be very important. So we do trip importance. You can see the destinations here, but of interest to us is that participants were unable to complete nearly 16% of the trips that they planned during that 2-week study. That was nearly 1 in 5 trips. Some of those were grocery stores were also unplanned, and a fourth of grocery stores were missed, and the pattern was very similar for doctor appointment destinations. We also, in our qualitative feature, published an article where we looked at social exclusion using the framework of social exclusion, which looks at resources, participation, quality of life. There's even a question in there, how do you get out and about? So we send these text messages over a 14-day period, and here are the primary themes related to transportation disadvantage and this framework of social exclusion. So we saw older adults talking about constrained autonomy and flexibility. They were concerned about safety. They had diminished emotional well-being. They had barriers to community engagement, and there's my timer, and the idea that it was burdensome. So those were kind of our 5 primary themes from what we call our Travel Buddy, which is our text messaging feature where the research team texts the participant for 14 days, and you're assigned one-on-one. So in terms of just conclusions from thinking about, again, my interest in transportation disadvantage and older people and the use of this app, this innovative data collection tool, the rate, even from the small study of missing desired transportation is troubling. So folks may be missing out on opportunities that directly relate to their health and well-being. We looked at that text messaging data, of course, and saw that that was affecting their emotional well-being and contributed to social isolation. This study, I should say, was done before COVID, but we know social isolation, particularly in later life, can lead to negative health outcomes. So we think that, again, apps like maybe MyAmble or this sort of holistic approach. For one thing, we have a very interdisciplinary team of social work, civil engineering, some planners and also computer science. So that's even that approach is from those perspectives, but also the idea that you have qualitative, quantitative data looking at latent demand and these very community-based, this is very community-based research. So as I sort of bring us back to my title slide, when I think about mobility and aging, I think about transportation disadvantage being a significant barrier to getting out and about. So that's it.
Excellent. Thank you, Noelle. We'll get back to more questions. I invite our next speaker, Ms. Jana Lynott. Jana has already uploaded her slide. Perfect. Floor is yours.
Okay. Well, wonderful. And thank you so much for having me join this esteemed group. So I've been asked to talk about the impact of basically urban design and transportation policy on the mobility of older adults. And so let's trying to get to my notes here. Okay. Am I still showing the presentation?
Yeah,
Yes,
you're
good.
Okay, great. So let me begin with perhaps what is most obvious, and that is that our almost singular focus on designing for the automobile has had tremendous impact on the mobility of all of us, but especially on non-drivers. And about 1 in every 5 individuals over the age of 65 do not drive. And if you actually cut the data down into subgroups, you'll find that more than 1/3 of people of Asian and Hispanic origin in the United States over the age of 65 don't drive. Nearly 1/3 of Black elders are non-drivers, and a full 35% of women 75 and older do not drive. And you know, I think as Noelle alluded to, that one of the measures of mobility is really how much do we get out of the home. And so our research of the National Household Travel Survey finds that for working age adults, you know, pre-COVID, about, you know, at most, you know, 15% of us report not getting outside the home on any given day. But for among people 65 and older, that's a full 1/4 of the population. And among people 75 and older, it's a full 1/3. And so among those people 75 and older who do not drive and who stayed home on a given travel day, 4% said it was due to a lack of transportation, but another fully 42% said it was because of a disability. And so you really have to wonder, given that people do express an interest in getting out and about more, whether they're just lacking good transportation options for people with disabilities in order to do that. And also, as Noelle pointed out, there's definitely impact on individual health as well as on societal cost from missed doctor's appointments. Now, our focus on designing for the automobile also has serious safety implications. So between 2009 and 2019, more than 57,000 pedestrians were struck and killed by motor vehicles in the United States. And more than 11,000 of these individuals were people 65 and older. And you can see from this image that the relative pedestrian danger increases with age as our bodies become more fragile. It's much harder for us to recover from a serious crash. And traffic speed is a top killer. At 40 miles per hour, 85% of crashes involving a person walking are fatal. And that risk is even greater for older adults. And this plays out in my own neighborhood, in the other Arlington, this being Arlington, Virginia. And at this intersection, 2 older adults have been killed, older pedestrians, in the past 2 years. And in the past 6.5 years, more than 70 crashes have occurred, including these 2 fatal crashes, 1 debilitating crash involving a teenage pedestrian, and the rest involving some level of injury or property damage. Now, the county and the state DOT are working on some spot improvements to improve the safety of this intersection. But unless we make a commitment to slowing traffic break down on our urban arterials, we're going to continue to see this level of carnage, I believe. The speed is posted for 45 miles per hour on this 6-lane road, but drivers routinely travel 60 miles per hour. And this is an urban roadway where there are a fair amount of pedestrians and cyclists crossing here every day. Now, people who do not feel comfortable walking across an intersection like that in order to catch a bus or just get to the other side of the street, it really should not be a reflection on them as individuals, but a reflection on the problems with the design of our road environment. So if I leave you with any message today, it's that people are not disabled. Environments are disabling. And that's true if we design our urban roads for 60 miles per hour. And it's true if we fail to essentially set the right rules of the road. So in my county, Arlington, Virginia, a few years back, the county adopted a new regulation for micromobility devices, these electric bikes and scooters. And essentially, they prohibit users from parking these devices on private property, which makes a lot of sense, except that the great majority of sidewalks in the county are only 4 feet wide, which is the minimum width for ADA wheelchair access. So in essence, there is no legal place for people to park these devices and get them out of the way so that they don't pose tripping hazards for older adults and obstacles for people with disabilities, and many others for that matter. So is there room for optimism? Well, I believe there is. So there are many cities. New York is probably the city that has done the best job of documenting its improvements. And the city has had a Safe Streets for Seniors program since 2008. And they've been able to do a number of these types of spot improvements, such as installing median refuge for pedestrians, getting rid of parked vehicles closest to the intersection. And across the city, they've been able to bring annual senior pedestrian fatalities down by 17% citywide. So huge improvement there. AARP has been working with communities around the country to improve safety and restore life on the street through pop-up placemaking projects like this one in Bethel, Vermont. And oftentimes these temporary improvements lead to permanent solutions. The city of Alexandria, in places in DC and other cities, have removed a single parking space at the corner of commercial districts and replaced it with places to safely park micromobility devices. The companies themselves have invented docking stations that will charge these vehicles, as well as create space for them to, safely stay out of the way of other pedestrians. Unfortunately, these types of docking stations still remain very controversial. Autonomous vehicles hold promise to increase mobility if we pay attention to myriad factors that ensure the technology is beneficial to the hardest to serve and does not cause inadvertent harm. And this is a paper that AARP, in cooperation with the RAND Corporation and Urbanism Next, put out last year that really lays out a framework of all of these different factors that we should be considering as we look to design for an autonomous future. And then finally, there's a tremendous amount of innovation happening in the transit and shared use mobility space, starting with mobility as a service, which is really a way to bring all the different ways we get around our communities into a common system. And if we intentionally think about how do we bring specialized transportation services into this framework, then we will be able to achieve the promise of what I've termed universal mobility as a service. So with that, I will pause, invite you all to check out these resources in more detail at our website, aarp.org, Future of Transportation.
Thank you very much, Jana. Excellent. We had two amazing talks. So before we move to audience and our question, I would like to invite Jana and Noelle, if they have any questions from each other, to please go ahead.
So I guess I can start, Noelle. I really liked how you started, framing your conversation about a strength-based perspective, and wondering if you can talk in a little bit more detail about if we as transportation planners really come at designing and planning for the needs of older adults from a strength-based perspective. What do you think some of the shift in our thinking needs to occur? What should we be thinking about?
Well, I think one of the most important things is that we talk to older people and we ask them about design, and we ask them about what they want. And we find out from a diverse communities and cities and rural versus suburban. So I think in social work and other social science disciplines, we do a lot of the community-based research. So we have committed stakeholders at the community level, really able to capture the voices of people that may not be showing up to the place like here, where they'll have the city council meetings, or they're going to have the meetings from the North Central Texas Council of Governments. And they're trying to engage the community, but they're having a difficult time for lots of different reasons. And so really kind of using more probably these community-based participatory research methods would be better serve the folks that are making transportation planning decisions. And again, I think it's sort of what you talked about, the idea that it's the environment is what's it's not focused on the deficit of the person. We're all getting older. I think even our language about aging, and AARP does a wonderful job talking to the general public as well as researchers about our language about growing older, that it's all of us. It's not us versus them. And so I think that's an important thing about the design for the environment. And I also think that AARP does a good job of talking about livable communities. Some of the researchers that I work with are looking at ways that design for older people, of course, can help young mothers who are experiencing homelessness, in and out of sheltered environments. There's been some collaboration I've had with some folks. But again, thinking about less about the deficit of the individual and really thinking more critically about the environment. Of course, in my experience as a social work researcher, I bring a lot of that, I think, to the table. And what I've really learned a lot more about is obviously the cost-effective measures, or the idea of what is the cost of all these different innovations, or so I know that planners are looking a lot at that. But it's nice to be able, it's been a real gift to be able to work with planners and civil engineers with social workers to sort of, in my way, and I think we all want to solve a social problem, and we bring the different perspective to it. But certainly in social work, we're looking at that strengths base versus the deficit of the individual.
Great, thank you.
So I know you mentioned, oh, I'm sorry, go ahead.
No, I was going to say, Noelle, if you have any questions.
Yeah, so I am here, Arlington actually has been launching some autonomous vehicle trials and things like that. I'm not involved in any of the work with older people in that capacity, but I was curious about, a lot of people are talking about autonomous vehicles, and I'm curious about what you've seen in terms of, is this a solution that's really viable, and for whom is it going to address gaps in transportation mobility?
Yeah, thank you for that question. I think with autonomous vehicles, there's a strong potential that it could increase the mobility for a certain segment of the older population, the segment that is fairly mobile in the sense of having physical mobility and strength, and even in cognitively, but perhaps they have some vision issues or mild cognitive impairment where they don't feel it's safe to continue driving themselves, but they're still independent. And what tends to happen as new technologies roll out is the technology companies are really testing it out on those easier to serve population groups, and they're not really diving into, okay, how does this really work for people with more serious levels of cognitive decline? How does it work for people who have more mobility, physical mobility limitation? And so it's those types of questions and factors that we need to be considering. We also, in our paper with Rand and Urbanism Next, talked a bit about some of those design side elements of the transportation infrastructure that need to be considered. So if you look at ride hailing as kind of a precursor toward how fleet-based autonomous vehicles might roll out, we can already see some very, very big problems with that transportation system, because right now we have not designed for these vehicles, even ride-hailing vehicles, to be able to access the curb. So people, passengers are being left out in the middle of the street. They're blocking sidewalks and crosswalks where pedestrians would need to get across. They're parking in bike lanes, creating safety hazards for other road users. And so we really have to rethink that curb space and how we're going to, realize the promise even for those who are able to take this form of transportation. So there's a whole host of things that need to be considered. And at this point in time, there isn't really any particular entity that has made these harder to serve populations their priority business toward really elevating these types of issues up. So there's a lot of work that needs to be done in this area.
Thank you. Both amazing questions. So I'm going to ask, before I have two questions, but before I will ask you to ask this question, and also remind attendees that if you have any question, please feel free to type them in chat area, or if you want to ask them yourself, you can feel free to raise your hand in the reaction at the bottom of your Zoom. So you can raise your hand so we can get to you as well. Peter, please go ahead if you have a question, and then I will.
Yeah, I found it really interesting to hear the two presentations today. Quite interesting how technology is being used in the research there in Dr. Fields' project, and I think that's impressive. But I'm also aware that older people and technology is an area that perhaps more in the UK, I don't know, but perhaps also at the higher age range, leads to perhaps less satisfactory solutions in some respects, where older people don't always have maybe the same affinity for interacting with electronic devices. And I guess one of the things that might be interesting to explore in the future is how particularly people in that 7-year period beyond the capability to drive, as it were, that you also pointed out there in some of the data you showed, how that group of people might be looking for perhaps other solutions, other support methods, and whether autonomous vehicles are going to perhaps present the same kind of interface issues, maybe that older people might have with, for example, smartphones. So there's possibly something to unpick there. In the research that you did, Noelle, what do you notice about the sort of different responses of people at different ages through in that period beyond 55 and up to not quite infinite? But
yes, so we, there's some limitations. We didn't really capture, like 80 and above. That there really weren't participants they're probably more in their 60s. And we really, because such a small sample, we didn't really break it down, or we haven't yet, by the different ages. Definitely these folks though had differing levels of, physical mobility issues and other things. But that would be interesting to see. And we're actually launching a study right now where we are looking at using the app in 3 different communities, not just with older adults, although Dallas is going to focus on older adults in a particularly disadvantaged part of the city. And we'll be able to, I think, explore a little bit more because the sample will be larger. But one thing I can say, we've used MyAmble recently at Ohio State University, and they really were looking at more aging stuff with AARP and around safe routes to aging in place. And so they really used MyAmble to work with older adults who were much more active than those in my sample. And the questions from Travel Buddy in particular were more about barriers to or facilitators of alternative transportation. So they're very interested in Columbus and Franklin County and looking at alternative transportation. And so it was interesting to see how older adults shared both quantitatively and qualitatively, which we haven't published yet, their experiences about feelings about alternative transportation. And we also looked at sort of this idea of a behavior change. So many of these older adults really talked about, I have not planned at all for that post. I didn't look ahead for the, when I'm not gonna be able to drive anymore. And the idea that I need to be thinking about it, and more talking about relying on family and friends, but also thinking about Uber and Lyft. So that was another way we sort of looked at using the app in terms of looking at alternative transportation. But one thing you mentioned that's interesting, one thing we found with our app in these different studies we've done is the travel buddy feature, which is the qualitative portion. Upon reflection with some of the participants, is that kept them more engaged versus just like your daily diary, where this was something where, particularly for the older adults in our sample that were very socially isolated, they really enjoyed the engagement with a person through the app during the 14 days. So you really actually can get some quite rich data that way. Of course, that's more time intensive and resource intensive, probably, if you talk about scalability. But for us, it was a really interesting and continues to be an interesting piece of looking at transportation among older people.
Sure, thank you. Yeah, and a quick question, if I may, for Jana. One of the things you looked at is, or you commented on the New York Safe Streets for Seniors, I think it was called, project. And I'm just wondering, in Europe, in the UK, and stemming from Holland, there's been this sort of shared space approach to integrating, let's say, low-speed vehicular travel, maybe micromobility, as well as buses and cars potentially, into spaces that are shared with pedestrians. I mean, what are your experiences, or what is your kind of perception of that as a way forward for enabling older people to kind of access places easily? Is that something that you've encountered in your investigations?
Well, I've certainly read about shared spaces. I've experienced a couple of shared spaces when I've traveled to Europe. We have a couple here in the United States on a much smaller scale. And, the theory behind this, and I think it plays out in traffic statistics overall in safety data, is that when you slow a space down, then, people, and you kind of mix things up and create kind of, I don't think others may refer to it as chaos, but it's a little bit of a chaotic environment because everyone is there in the same space, and it's not space carved out with little niches for individuals, different groups. Then everybody knows they have to pay attention, they need to slow down, and the safety can be enhanced. I would like to see more research on what the impact of those environments are for older adults and people with disabilities, not only among the people using those environments, but if there are people not using those environments because of a discomfort level. And I think it really varies by the space, and I have heard some negative things from people with visual impairment as to their comfort level in those spaces. So I don't know that we have all of the information we need yet as to how well these spaces are going to work for everyone.
Okay, Mortaba, I know you have many questions, but I just like to flag up, we have a number of people here with let's say vehicle design expertise.
Yes.
And I think great if we can allow some of them to also
if I want to be fair, first let's just ask the question by Eric, and then we go to Stefan. Steve is a designer, so to keep Eric asked, it was mentioned that there is a lot of innovation around mobility as a service. Is there research being done on MAS, on mobility as a service, and its impact on healthy life expectancy, maybe better access to healthcare or less social isolation? If no, why? Why not, do you think? Or the research on the impact of mass mobility as a service on well-being of elders?
So maybe I should just start with a quick explanation, because I didn't go into very much detail as to what is mobility as a service. But essentially, you create these systems where people can look up on their smartphone or desktop computer, or maybe there's a call-in line. What are the different options? Of these options, how much is it going to cost me in terms of dollars and time, and help people make a choice as to what the best travel option is for a given trip. And then on top of this, you enable people to book that service, whether that be through a ride-hailing company or ideally with existing specialized transportation provider. And then you also allow people to very seamlessly pay for that trip, and it facilitates mode transfers as if to get from point A to point B. In terms of research on this, because there really isn't any project that's been built out fully at this point in time, everything is a work in progress. I don't know of any research that gets as specific as what the impact is going to be on things like life expectancy, social isolation, etc. So we're all in kind of a conjecture state at this moment in time.
Do you have any thoughts, Noelle, or?
No, I know in Arlington, they've been looking at mobility as a service, and one thing that I was just involved in a small piece of that research that they launched. They were using VIA, which is sort of subsidized by the city of Arlington. But the aspects that we were looking at were, you know, why were older people and persons with disabilities, why were they or were they not using it? And a lot of it came down to the unbanked population, meaning those folks that, you know, really a credit card was not going to be an option. And that was a barrier because it required a credit card. For some, the technology was a barrier. You could still call in, but a lot of people still mention the app. And the other thing that people mentioned was it was not door to door, this idea of the curb to you know, however they set it up, where it wasn't door to door was also a barrier for people. So that's like Jana said, it's not getting to the question really. That's a larger question, but I'm sure lots of work will be done on this area, and it should, because seems like it has some promise. But again, you know, asking people.
Thank you. Steve, please.
Oh, thank you. Well, Jana and Noelle, thanks for your great information. I mean, I'm now one of the more senior designers, and as Peter would also say, we're, you know, charging through all these new designers to do transportation, and somebody created a sumo suit to create the same atmosphere as an older person, and that's almost like trying to create the zero gravity biro versus the pencil. There's actually a much more better way of finding out what old people need. It's kind of that and that and that. You know, and it's, I think from a designer perspective, we need to listen more rather than create simulations. We need to listen more and appreciate what happens. I mean, the judgment of speed crossing a 6-lane highway, yeah, I can see that. Balance, you know, putting people on bicycles or whatever, not going to work. Memory loss. I mean, you know, my father went through that whole routine. He got into his car and he couldn't even remember where he was supposed to go. So tiredness, eyesight, and acceptance of their situation, that they're old. A lot of people don't like to admit they're old and have a problem. So one question I have for kind of Noelle is the kind of social health thing. How does it relate to recreation versus chores and necessities? I mean, mental health is probably more about getting out and recreation, whereas perhaps the chores and the necessities, the chores especially, maybe the delivery of food is becoming increasingly popular in the post-COVID world. The necessities about going to a doctor's or hospital appointment, yes. And we have a lot of hospital cars here in the UK where you can order a hospital car and they'll come out to collect you. So there are already sort of situations in play. And I have a big problem with autonomous vehicles, because in many ways they're creating more problems than they're solving. Better than a chauffeur or a kind of driver, or related to buses from the local supermarket that come and pick you up outside your door, whatever. There are solutions, I think, that we've already established as designers.
You're muted. We missed the end of your question, Steve. Sorry, so, like the last 10 seconds.
Okay, so let's say the question is now, where do we go? Do we need to, in Jana's case, look at traffic calming on that junction? You know, these little islands that you see in New York, maybe each lane should have one, so it becomes easier for people to cross. And those traffic calmings will also reduce the speed down from the 60s to the 40s, for instance. So as a designer, there are solutions, and we're constantly looking to find new ways of improving, but we have acceptance, and that for a lot of people is still a problem of accepting that they're getting old. My mother just yesterday sold her car after 60 years of driving at the age of 85 and said, well, now I have more money for taxis. And I think she'll do that. And that's the kind of attitude that accepting their situation is part of the realization that they do need different requirements. And that's not just old people, it's all people with disabilities, as a beautiful phrase from Jana says. It's not about being disabled, it's things that are disabling. So maybe the vehicles that come to pick these people up are actually more capable of dealing with disabilities and aging, low steps, kneeling vehicles or whatever. Maybe we have to create some sort of vehicles that are ideal for these situations. Thank you.
Thank you. Excellent point. Does Jana or Noelle, anybody would like to expand?
I have to comment.
Please.
You know, Stephen, your comment that we need more acceptance of our situation as we age. I think what strikes me is the need to normalize ways of travel that are not driving before we hit older age and have to give up the keys. And, you know, many of the ways to do that is to be looking at how we're designing our transportation system today and make sure we're designing it for all the ways to get around the community in a safe and convenient manner. So if we take the road in my neighborhood that's 6 lanes wide, if we really want to balance that system and welcome people, not just say, okay, we're going to do some spot improvements so you don't get killed if you're stupid enough to try to cross the street, but actually say, we want you to walk across the street. We want you to bike. We want you to take the bus. And so how about we get rid of one of those travel lanes and turn it into a bus only lane? Because the density is there in order to do that. How about we make sure we have turn lanes, you know, and where we don't have turn lanes at the intersection, have a median that keeps cars, you know, kind of constrained so that they're not driving 60 miles an hour. You know, there's a number of ways to address things through design. But then on top of that, when we start thinking about the mobility as a service systems, how important it is that all of the ways that people who have more specialized needs travel need to be part of that system. Right now, we have 2 systems. We have systems of transportation for the haves who are able-bodied, able cognition, able financed, and we have transportation systems for the have-nots. And so unless we bring those together in a common system, we will continue to have these kind of inequalities.
Totally agree. Yeah, totally agree.
Yeah, I like how, you know, you're talking about that. I think for some of the research we're doing, we're really talking about moving from access to equity, like you're talking about, in particular, you know, like you said, the haves and have-nots, and designing for the study we've been doing in Ohio, in Franklin County, is just that, talking to older people, promoting alternative transportation now, well, so that they can start thinking about it, but also thinking about how do you create these alternative transportation systems, options that are it's not just getting to and from the doctor, but it is the things that make our quality of life as humans important, that are vital to our health and well-being, is the social connectivity, being able to be in places, the green spaces, being able to connect with others, civic engagement. And so that's an important piece of it. It's not just getting the to and from the doctor or to and from the grocery store, but as we are today and as we age, there's more to us than that, right? And that social connectivity, we're seeing that, I think, even exacerbated by COVID, but social isolation, regardless of age, it's shown to have negative health impacts. So anyway, that's just my 2 cents.
And I would say that we'll know we're successful when, speaking of terminology, when we don't have to refer to these ways of traveling as alternative, that they are normalized.
Yeah.
And if we normalize them for the entire lifespan, then it's not such a huge leap for people to have to accept a change in their capacity.
I agree.
That's a very good point, Jana, because actually when you look at the other end of the spectrum, the kind of young adults from the age of sort of 11 to sort of 15 years old, they also have a sort of a growing transport need that we see issues with today as well. So a good system solution would actually benefit both ends of the spectrum.
Exactly. And if you actually include people too young to drive and hold a license in the United States, a full 1/3 of our country does not drive. So think about that and how we have designed our transportation policy around driving, and yet we're leaving out 1/3 of the population to some extent.
I want to actually build on that. That was actually an excellent question, an excellent points raised by both Jana and Noelle and Steve about the level of intervention that it really should be before designing the cars. Yes, the cars should be inclusive. The design of the cars should be inclusive, but before that, we need to have inclusive city design, inclusive mobility, accessibility, mass. So I will ask Carol Mary's question, which is related to this, and then I ask my own question, which is, Carol Mary asked, the autonomous vehicle strategy seemed to continue the vehicle-centered urban planning model versus building of sidewalk, which I think is more sustainable, mobility friendly, if you like, beyond the minimum bit. How can we re-educate road designers to design for lifelong mobility? Lifelong mobility, yes. Please, Jana, Noelle.
Yeah, I think it comes back to some of what we have already talked about, is that, when you sit down for getting community input, that you need to make sure the various perspectives are represented at the table, that older adults, and not to assume that a couple of older adults are going to be representative of the community, because I've been to plenty of community meetings where there's a couple of older gentlemen who drive and who are really adamant that we need more parking and we need, to deal with the challenges that drivers are facing. And that is not representing the perspective of individuals who don't drive or who may have incomes too low to be able to afford a car. So having those perspectives at the table is very important. And we need to make sure that we're asking the right questions and making sure that we really prioritize safety, that we prioritize mobility from the standpoint of, are we going to be able to complete those 16% of trips that older adults are currently not able to complete? Thank you.
Is it okay, Peter? I ask my question and then hand over to you. Sorry. So my research, one of the main part of my research is in driving. So I studied driving, vision, cognition. So I studied visual impairment and driving, cognitive impairment and driving. So a core problem I've noticed over the past less than 10 years that I've been researching elder drivers specifically, and overall these drivers with impairment, is how easy it is to make elders targets, to make it sensational. For example, we had a crash here in Boston 2 years ago, and they had like a news conference, oh my God, we have to stop elder drivers from driving. Like young drivers are like 10 times more worse, and we know there are ways to stop this, but it's easy to make it sensational. And I've come to I believe there isn't really an easy way that a researcher can do, and I think correct me, this is what I want to hear your thought on. The only really way to change this is in policy level, using political power or campaign like places like AARP or whatever. But it's not really, I think it's needs a high level intervention to make that change. Specifically policy, either speed limit or, for example, regulations with driving, providing driving license, the visual requirement or cognitive requirement, they're really baseless. They really are random. Is there any other way apart from political intervention? Jana, Noelle, whoever has thought.
I don't know that there's an easy answer. I do notice this bias in it, the media perpetuates it, and then it shows up in our planning documents. So for instance, the safety study for the county that had a pie chart of where the problem crashes are occurring, and they had a piece of the pie was older drivers as the problem, but there was not a piece of the pie chart where there's teenage drivers, which I would imagine they're also crashing in places in the county. And perhaps AARP should have answered that call to go on record in that latest Boston crash and talk about this and make sure that this message is getting out there. But it is probably the more difficult thing, because we're dealing now with kind of that subconscious bias, and it shows up in different ways. And it's like, for one, you have to be educated to identify the bias, and then you have to do something and speak up and say something. So I don't know, maybe Noelle has some better thoughts.
Certainly, I think, policy is important, and I acknowledge all that, but I do think that this is something that, as an academic, that I can do, as a social work practitioner, that I can do in terms of training students, interdisciplinary collaboration, where we're talking more about let's squelch this ageist language, talk about aging differently, how we're all going to age, lifelong mobility. I mean, that language should be better infused across disciplines from a research perspective, but also at these other county level or whatever, places that planners are working in different initiatives. So I think, of course, that requires a paradigm shift. I'm thinking about the US, but how we look at aging, how we think about growing older. But I think that, again, bringing the voices to the table, you can't just have a couple older adults who weigh in. You really need to have, and not just older adults with resources. We have to think about the folks that don't have resources, that are under-resourced, that can still make a contribution to our community, who want to contribute to the community, who want to be part of the community in big or small ways. And so those voices have to be heard and acknowledged and invited. So I think there is an impetus on those of us who are academics, and maybe bridging between academic and practice, about the language we use, about speaking up, like Jana said, about like, wow, that pie chart, hey, let's flag that, and it's just, and that's work for all of us that we have to do on an ongoing basis. But that's again, and I'm a social worker who works kind of more at the micro and meso level. So I work a lot with individuals and communities. But there are community agencies and partners all over that would be willing to work with transit agencies. So I've interviewed lots of social workers who are saying, I can't get, how do I reach out to people to change policy, even in my local community? I don't have access. And yet I represent all these clients who their number one issue is transportation in Dallas-Fort Worth. So.
Thank you. Peter, please. Thank you. You're muted, sir.
Yeah, I've got to learn how to do the hotkey for muting. Is it the space bar? Remember?
Control A.
Control A.
Yeah.
I wish all these software were the same, had the same interface. But maybe that's just me aging. At 58, I'm kind of starting to lose the plot a little bit, I think, in some ways. This has been a fascinating topic for me to assist you in today, Mustafa. and to meet Noelle and Jana and so many colleagues from around the world, and it's been great. My own perspective, I suppose, is that aging is a lifelong process, as I think has already been said. And I teach students, and I'm going to be encountering within a month a group of about, who knows, somewhere around 100 18-year-olds, 19-year-old students, and in 3 months' time, I need to start talking to them about ergonomics, anthropometrics, designing for people of all kinds of abilities and capabilities, and who better can they ask than their own parents and grandparents? And they probably don't necessarily realize it, but they observe their own parents, I'm sure, changing. The things they do change over the life course. So I think it's right that we don't necessarily focus on old age as a specific thing. What we need to do, I suppose, is look at how capabilities shift over time, and we need to design around that. And yes, autonomous vehicles are sometimes proposed as the solution to perhaps more limited capabilities in life course. I'm sorry, I'm not phrasing this as a question, really. I suppose it's because in my own research a while back, I looked at multimodal travel, I looked at cycling and public transport, and something that I didn't kind of pick out on in my thesis was, but what I did observe is that older people tended to travel quite a lot because it was a challenge, because it was something they enjoyed doing, and the travel was not just to get to the doctor's surgery or something else. It was for social reasons, it was for physical health and activity, it was to kind of keep busy also. And maybe that might be slightly different in perhaps parts of the United States from perhaps an urban British environment. I don't know, but I would imagine that keeping people mobile and active, and as I think you've already started to suggest, that should be something that's built in much earlier than as an old age thing. So thank you for those really valuable contributions there. I think the other thing to just perhaps think about for the future, perhaps a future topic for one of our other discussions, is how perhaps the way that the road system, the transport network is developed and has shifted over time slightly. It's always been driven by an economic imperative. Whenever we hear our government talking about future transport solutions, they might, as a sort of side benefit, say, well, it's going to help people, older people perhaps, or younger people, or people with children, but their primary focus in almost every instance, this is for the economy, you know. And I'm just wondering, is the economy's shift towards perhaps servicing the needs of older people also going to, over time, start to actually implement those changes that we're talking about now as seeing as necessary? But how much, you know, as we shift from being producer nations to being consumer or being lifelong active nations, perhaps that's a process that will evolve. And however hard we try as researchers and active people in our spheres of industry, that will probably just evolve at the same pace as it always has done. But slowly we will get those islands in between the lanes to enable the person to cross who hasn't got the ability to judge speed so well. Slowly we will see autonomous vehicles starting to steady the speeds of traffic, as they are limited, if you like, by their programming, by their legal connections to obey those speed limits that human drivers find it convenient to shortcut. I don't know, but I think there's an interesting area to observe as we go forward. I'm rambling on, but
no, that was good wrap up of the session. That was good. Before we say goodbye, I want to ask if Jana or Noelle would like to say a final point.
I think Peter summed it up really well. So
Yeah.
Great. Thank you very much, Jana. Thank you very much, Noelle. Thank you very much, Steve, and all the attendees. Thanks for your questions and involvement. It was great to see everyone. And when the recording is finished, usually within 2 weeks, we will share the recording with you. It was amazing. Thank you. Thank you for your time.